programs. Today we're talking to Dr. Hannah Allen. She is one of our faculty-led programs for the Study Abroad office. Would you like to describe your program and what it is?
Sure. So the program that we're doing is Public and Community Health in Argentina, and that's going to happen next summer in 2025, and it's a short-term study abroad, so it'll be about like 12 or 13 days.
What are the dates of your program?
Yeah, so it's going to be during the summer in 2025. It'll be the first 2 weeks of August, so I believe it's August 1st to the 12th, 2025.
And what inspired you to start this trip to Argentina?
Yeah, so we actually launched the public health academic programs at the University of Mississippi are actually new. So we launched a bachelor's and a master's program in public health back in 2020, was sort of when we started to transition our community health education programs into more broad public health. And so as we've been working on that the last 4 or 5 years, we were talking about what would really sort of round out our degree programs, and having Study USA and Study Abroad opportunities was really important to us in the Department of Public Health. And so I love to travel, and so immediately I was like, I'll be in charge of Study Abroad. And so we were able to take students to South Africa back in 2023 and do a similar type of trip. And it was a really cool experience for our public health students and just students that have any interest in health-related activities, social systems, things like that, to be able to spend time outside of Mississippi, outside of the US. And so from that point, I wanted to see if I could offer every year, every 2 years, a trip to a different type of country for our students, and then also just students on campus, so that they could really extend their public health knowledge sort of beyond just our country here.
Could you give us an overview of what students can expect during their time in Buenos Aires?
Yeah, so we try to just sort of give a broad overview of what the health system is like in a different country. And so there's kind of 2 different parts of it. There's the healthcare system, which is like the treatment system. So we're going to be able to go visit some different like primary care clinics and places where people would actually get healthcare, like hospital systems. But then there's also the public health system, or the community health system, which is going to be a little bit more of a look at sort of the broader perspective of health. So being able to go to maybe nonprofits that focus on health issues like food sustainability or maternal and child health or mental health, and then also being able to talk to go to different like government institutions and think about like health policy and how that affects health. And then we're also going to be able to, at the university in Buenos Aires and then also at the Ministry of Health, be able to get some lectures as well. So from experts to be able to learn a little bit more about the healthcare system is structured, and just on different sort of like key topics that will be related to health topics in Argentina. But we also do have some opportunities for students to be able to just learn more about the culture. So we have lots of group dinners, visits to different cultural sites like museums. I think there's going to be like a tango class, which I feel like I might not participate in, but we'll definitely. And so different things where it's not just only focused on that, but they also get to kind of get a holistic picture of what the culture in Argentina is like.
And is there a major that this program is aimed towards?
Yeah, so we advertise it pretty broadly. So it's open to undergraduate and graduate students. So I always encourage folks that are also getting, master's and doctorate degrees to think about if this trip works for them as well. We advertise it to our public health students, but it's really relevant for a wide range of students. So anyone that's interested in any type of international relations, political science, anything else that's in the School of Applied Sciences. So thinking about this is a good thing to mention. And so we are partnering with, there's another department in the School of Applied Sciences, Communication Sciences and Disorders, that was interested in partnering for this trip. So we added a few specific site visits that are directly linked to sort of like speech and language services. So it'll definitely be relevant for students that are studying communication sciences and disorders, students studying nutrition, allied health, anyone that has just in sociology, anthropology, psychology, just anything that could be sort of connected to overall like health and social issues. But honestly, I think anybody could go and would still find it to be relevant and interesting. So there's no particular major of students that can go. It's open to anybody. And so there's no like pre-existing knowledge that's needed in terms of different topics.
What do you think students gain, not only academically, but practically from this experience?
So I think they gain just a broader picture of how health is approached as a topic in places outside the US, because the US has a very unique healthcare system, and how we're organized is mostly a private sort of insurance-led system. And we're also a very reactive country. So we're a very treatment-focused model, and most of our healthcare spending is on treating disease as opposed to preventing disease. And so the goal of being able to have our public health students in particular, but just really any student, to be able to see how other countries approach, I think that they'll find that a lot of other countries have more of a prevention-based model, and a lot more of their healthcare spending goes into sort of the more of the public health realm and the less of the healthcare realm. And so I think it's important, as we see health policy change over time, for students to have that outlook of how other countries approach it, and how maybe we could also work to adopt some of those ideas into our system here in the US. And so thinking about places that have universal healthcare or publicly accessible healthcare, which is very different than how it's structured here in the US. So my hope is that they gain sort of that perspective, so that when they come back to hopefully work as health professionals in the US, they have that knowledge that it can operate differently and we can make improvements to our health system here. But also I think just in college as well, it's important for students to go other places.
Is there any advice that you would tell students about this program, whether they'd be nervous about being in Argentina or just studying abroad for the first time in general?
Yeah, so we have built in a lot of sort of supports into the trip to make sure that students are safe and comfortable, because I know that's really important, especially if it's a student's first time traveling out of the country. There can be a lot of anxiety with that. And so we partnered with with the School for International Training that runs study abroad programs for, they help universities plan them, and then they also just run them through their organization as well. And so they have this whole sort of system in place to make sure that students are protected and safe and oriented to the country, and have sort of every type of access to communication they need. And it's not only me and other faculty leaders that are available, but the SIT staff are available. And the SIT staff are also folks that are from Argentina and have worked within that country. And so I think that there's sort of that comfort that they can have, that the trip is going to be well planned and well run, and that everything that they would need to feel comfortable they're going to have. But then in terms of easing other anxiety, I think going with a group is always great. So we're going to have 2 faculty leaders, and we're always available for anything. And if someone felt sick or just needed to talk or anything like that, and then they'll also have each other. So there are options on study abroad to stay and do home visits, where you would actually stay with a family in the country where you're at. But for this trip, I always have all of us stay together, even in like a hotel situation or sort of like small apartments, because I think that that also helps to ease a little bit of the anxiety, because then you're having a place to come back to at the end of the day where everyone's together. The other students, the faculty are never far away, so that they're not feeling like they're isolated in a place that they don't know. And we also have orientations before we leave, so they can kind of get to know everybody. But it's really just sort of making ourselves available throughout, and knowing that this is a good way to do it, because it's a short-term trip instead of going somewhere for maybe a whole semester, so they can kind of get a sense of how they feel about being away from their family, friends, the campus, and then sort of see if it would be something that would interest them later in life as well.
Is there any time for the students to go by themselves and explore, or is this just going to be a mostly like faculty led type program?
Yeah, so the students are going to have, I think we actually built in 2 free days, so where we will give them suggestions and recommendations of different places that they can maybe go explore. But it's really up to them how they'd like to use that time. Some of them might just need a day to relax and take a nap and, do those things, but they're more than welcome to go out and explore on those days. So while we will have a schedule kind of set out on the majority of the days, we do have some built-in time if there are other types of sites that, are not on our list that they want to go explore, or they just want to go out and just sort of spend time with just each other And we will have some sort of safeguards built into that in terms of making sure that students are going together in groups and sort of staying in touch with us. But we do put a lot of trust in the students to just make sure that they can go out and sort of explore and see the area that they're in. And I think that free time is important for them to kind of be able to add in and fill in any holes that maybe we didn't have in the schedule. So yeah, they will have some time to be able to go out and sort of explore on their own.
So have you been on this program before? Is this the first time y'all are having this program?
Yeah, so this is the first time we've done it in Argentina before. And so, and it'll be my first time in South America, which is really exciting. And I've always, when I actually approached study abroad a few years ago when we were talking about doing a study abroad, Argentina was always the first place that I wanted to go. And when we were working with SIT on trying to figure out if they had the capacity to help us lead that program, it wasn't available back in 2023, but then we were able to kind of figure it out for 2025. So yeah, it's the first time for this program, but we have run the similar program that was in South Africa in 2023 that had a similar organization to it. So kind of a mix of lectures, site visits, and then sort of cultural activities, and having that about like 2-week time period. And I would love to be able to constantly just be offering a different location, because what the system, the healthcare system or the public health system is going to look like in South America is going to be very different than Asia, very different than places in Africa, and even different within different countries in those places. So I hope to be able to every year to offer a similar structure of the trip, but then work with SIT and study abroad to see if we can find somewhere new.
Are there any specific places in Buenos Aires in Argentina that students may really enjoy?
That's a great question. So we will I'll work with the staff from SIT that are from Argentina, kind of like the on-ground staff, to give us good recommendations for that, because we do have some things that are already built in. So we have a couple cultural museums that we're gonna hit, but on those free days that students are gonna have, we're gonna hopefully be able to provide them with a list of places that they might find neat to visit, whether or not it's sort of more on the environmental side, like visiting like different parks and things like that, or just like places to walk around to do shopping, or different cultural sites. So that's actually probably something we'll need to sort of generate and look into. But I think that area is like really rich in culture, and so I don't think students will be lacking for places that they will want to go and visit. Yeah.
How can students contact you if they have any further questions?
Yeah, so we have the program page that's on the Study Abroad website, which has my email contact information. They can also just look on the Ole Miss website for Hannah Allen, and my email address is on there. Email's probably the best way, and then we also have a co-faculty advisor, Dr. Brad Crow, who's with the Communication Sciences and Disorders Department, and his contact information is also on the Study Abroad program page. But happy to have any conversations. We can have meetings if students want to talk a little bit more about the program. So available by email, phone, in person, whatever works.
So thank you so much for coming in today.
Yeah, thanks for having me.